Thank you, Greg. I'm here now with Dr. Assini and Dr. Flott. They're from Greenwood Leflore Hospital. And like we said, November is Diabetes Awareness Month, and you were doing work in Greenwood to sort of educate the public. So thank you so much for being here this morning. We have a lot of education we need after the chocolate cake we had yesterday. So thank you for waking up.
I see some of the chocolate cake still around.
Oh gosh, don't tell me that. So tell us the work that you're doing with diabetes and also how it's really a big problem here in this region.
Well, first of all, the scope of the problem. We have about 30 million people in the United States that have diabetes, and tens of thousands of more people that aren't diagnosed yet but still have it. And with the risk factors of obesity, high blood pressure, sedentary lifestyle, and genetics, we anticipate these numbers to grow to really epidemic proportions.
Yeah.
And to that end, in assessing the community needs, our hospital, the board, the administration at Greenwood Leflore and its staff, and the doctors and the ancillary staff, we're trying to come up with a plan to stem the tide of these risk factors, because we do not want our community to end up with amputations and kidney disease and dialysis and loss of limb. And one of the components of our team approach to this is education. We feel education is the most important thing, to reach out to everyone in the community, from grandparents down to children. Just because you're a grandparent with the diabetes doesn't necessarily mean your children need to end up with the harmful effects of diabetes. And one of the key components is diabetic education. And to that end, my colleague is going to discuss the Diabetic Education Center at Greenwood Leflore Hospital.
Great. So tell us some of the work that you do at that center.
Our center started in 1996, and then over a period of time, we've gotten accreditation by the American Diabetic Association. We're one of the few centers in the Mississippi Delta that has an accreditation. Our center is made up of 3 nurse educators. We also have a dietitian. We have a support group that meets once a month. We try to get out in the community. Our educators participate in health fairs, just trying to, number one, let people find out that they have diabetes, and when they do, make sure they're getting to their physicians, knowing their numbers, their blood sugar, their cholesterol and blood pressure, and trying to get them under control.
It just seems like it's such a big task that you have to educate people and sort of stem the tide of this epidemic. What's sort of the first step that individuals can take for themselves, for their families, to make the right step, one step in the right direction? What would that be?
Well, first of all, they have to know that it's not a death sentence. It doesn't need to be, okay? And what we're putting together, we know that through prevention, early diagnosis, identifying the risk factors, and working together with a team approach, which is really a unique idea and concept, that we feel that communication through all the different medical specialists and the patient working together, we can do a lot to stem this diabetic epidemic. And to that end, in my future visits to the station, in which I'm very grateful to have that opportunity, is that we're going to be bringing different specialists that have a key role in working with the community to stop the end stage results. So the thought process is, if we do this, it doesn't mean we'll end up with a patient that will lose a limb or on dialysis for the rest of their lives. We can make a difference, and education is the key, and communication. And this opportunity to communicate to the public gives us the opportunity to do our job and to do our passion and to do the work that Greenwood Leflore Hospital wants to do to provide this care for the community.
And I know, and I'm very excited that you're going to be here every Thursday, because I think there's so much to talk about with this topic, especially in our region. And can people, lifestyle changes, you said being sedentary, being overweight, unhealthy foods, can give you type 2 diabetes. Is healthy lifestyle changes a realistic thing for is that's a big thing, right?
Absolutely, and most of these things can be reversed, and it's just a lifestyle change that if you start early in life, it becomes part of your life.
Yeah.
And I'm sure that you've seen the difference with your patients, right, Dr. Flott?
Absolutely. Just trying to get them living a healthy lifestyle, exercising, moving, and just seeing their physician so they know how they're doing with
Yeah.
their control of their diabetes.
Healthy choices.
And so when people go to your center, they'll learn about some of those lifestyle changes?
Yeah, there's a big education program. Medicare covers the education. A lot of private insurance covers education, particularly because we're accredited by the American Diabetic Association.
And then I have one final question for you. You said early detection is important in diabetes. What is some of the earliest signs that you might have diabetes?
Well, you're always thirsty, you're sweating a lot, you're losing weight. These are the things, but the key is if you knew that someone in your family had this, that's the first thing, and that test should be done. There's preventive blood screenings to catch this early, and in our next segments, we're going to have the specialist to discuss what to look for specifically and how to treat the disease itself.
Great. Well, thank you so much for being here this morning, coming all the way from Greenwood, waking up, and talking about a very, very important topic. And we're joking about eating cake yesterday. All jokes aside, it's a really important issue, so I'm glad that you're here to inform our audience. Thank you.
Thank you for having us.
We'll be right back.